I'm Didi. I'm a clinical engineer and I work at Guy's and St Thomas's. Well, clinical engineering can actually mean a lot of different things. It means basically that we're using technology to try and make healthcare work better. So for me in my role, it involves lots of things around health technology management, and that means making the most out of different technologies. So whether it's a scanner, an infusion pump, a splint or something simpler, all of these things have to be delivered within a system. And engineers, we look around those technical aspects, we ask those questions around how can we use these better, how can we make them more available, and how can we develop new and exciting technologies as well. I started out in university. I was studying engineering and I really wanted to know how I could use it to make the world better. So, of course, I looked for jobs in healthcare and I heard about this clinical scientist scheme. But I didn't actually have any experience at the time, and what I decided I'd do was to get involved with a charity called Engineering World Health. And I spent a couple of months in hospitals in Central America helping to mend equipment and to work on their maintenance systems, and that really gave me quite an introduction. But I wanted to go a bit deeper with the science of things, and the training scheme made that possible. I did the scientific training scheme, I did the scientific training program, and I was based at King's College Hospital. And it was great because I did rotations in a few areas. I learnt about imaging as well as equipment management, as well as biomechanics, and I was able to really specialise in an area that I was more interested in. So I've gone into health technology management, and as I mentioned, it's about decision making and how we strategically make better use of technology, but also we get involved with risk assessing and helping people to develop new devices. So my field is health technology management, but it's got a bit of spin of development and using data to make better decisions as well. In my trust, one of the things that we do is we select different contracts to support different equipment, and data can play a real role in making the best possible decision. One of the projects I've been involved in is predicting when X-ray tubes fail. An X-ray tube is a light bulb that produces the X-rays that we use to image people, but like a light bulb, they go bang. But when these go bang, they cost anything from £20,000 to £110,000. So it's of interest to us to know when they're going to bang, so we can actually make the proper preparations. And as a result of that, I was able to make some predictions that helped us to save quite a bit of money over a few years on these contracts. I think in my role it's quite broad. There are so many things that are medical technology, and for each project that you approach, you have to get used to working with a whole new set of people, deal with different cultures, and that's always challenging, but it's also something that makes it very interesting. It means that we're constantly learning on the job, getting to know how the hospital works and how we can make things better. I remember in some cases maybe convincing some medics that they needed to train before they put in a new protocol was one of the challenges I faced, but managed to get through it all right, and we were all on the same page in the end. What I could have done with that was to just explain all of the regulation to them and say you'll be liable for this and liable for that. But in healthcare, one thing that really unites us all is that we're interested in the outcomes for the patient. So talking about the risks and breaking down the purpose of that regulation is something that actually got us all on the same page and got my message across quite well. I really enjoy working with different people on different projects, and also a feeling that, and an understanding that I actually, through my technical abilities and learning, I'm able to contribute something that really does make an impact on the front line. I think if you keep that in your perspective the whole time, you end up doing your job better and enjoying it a lot more. Looking back, I think if I could speak to a younger Didi, what I would tell him is that he shouldn't be afraid to get involved with projects that may have seemed a bit out of his comfort zone. Being a little bit out of your depth means that you're in the best position to learn, and it means that in the end you're going to bring something new to that situation that can actually turn it around. At Guy's and St Thomas's, we're going to be putting on a bit of a showcase, and there's a showcase here in NHS England. So actually I'm looking forward to getting involved with both of those.